The test that we're going to be performing is the active straight leg raise test. This test assesses the flexibility of the hip extensors, more specifically the proximal hamstrings. The primary joint action during the active straight leg raise is hip flexion at the acetabular joint in the sagittal plane. Since this is a quantitative exam, there is a passing and a failing score. A passing score for this assessment is achieving at least 90 degrees of hip flexion with full knee extension without compensation. Anything below 90 degrees before the leg reaches vertical is considered a fail, indicating limited hamstring flexibility or restricted hip motion that should be addressed through targeted mobility training. To perform this test, the participant will lie supine on a flat surface with both legs completely extended. We'll be testing the left leg during this examination. The opposite leg will remain flat and stable to anchor the pelvis to the bed. It'll maintain a neutral alignment throughout the entire movement. The test leg will stay straight with the knee fully extended and the toes dorsiflexed to maintain constant tension along the posterior chain. For measurement landmarks, the goniometer's fulcrum will be placed over the greater trochanter and the stationary arm will align with the lateral midline of the pelvis. The moving arm will follow the femur down to the lateral malleolus. This is a quantitative test, therefore I'll perform 2 controlled trials per leg, and the joint angles will be measured later during the video editing to determine the average value, dominant and non-dominant difference, and the asymmetry index. A fail can also be indicated by any pelvic tilt, rotation of the opposite leg, or flexion of the knee during hip flexion. Now to perform the test, I'll have you place your arms to your side. Both legs are fully extended with the pelvis neutral, and I will go ahead and stabilize the non-testing leg to not allow any compensations or movements. Keeping the knee locked and toes pointed up in the air, I will have you lift your leg up as much as you can to the first point of muscular resistance. You could lift and stop and come back down. As you can see, the hip flexion angle does not reach 90 degrees, indicating a fail or a red test under the established grading criteria. Health risk-wise, tight proximal hamstrings can cause the pelvis to rotate backwards, tucking the pelvis into a posterior tilt, which can put the spine into a compromised position and put unnecessary stress on the lumbar spine. Thank you.